All right, we are live. Sorry for that short delay. Women are always late. We had
Right.
some technical issues because Tammy and I are always on the road. So that means we got to get on hotel Wi-Fi and all the things. But Tammy and I wanted to come on and do a live because we recently saw that House committee that was, Republican led, even though bipartisan. They
Mhm.
looked at all of the data over the past 2 years involving the COVID response. I mean, it's not news to us because Tammy and I, if you're new, real quick, we'll just do mini intros. So I'm Kristen Megan Kelly is my full name. I'm known as Kristen Megan. I've been an industrial hygienist and an occupational environmental health and safety professional for 22 years. March will mark 23 years. And I also spent 9 years on active duty where my deployment team was pandemic preparedness planning and response through MMBC, but that's also been laced in my civilian profession. So we blew the whistle. I have on more than one thing, but we really sounded the alarm
Mhm.
on how the government was handling it, specifically OSHA. So, Tammy?
Yes, and a lot of what she said, we joined
That's what
forces.
she said.
We joined forces, and throughout this, we met during the craziness of the pandemic very early in March. I think March or April of 2020. We were both saying the same things because we recognized as government trained experts, occupational and environmental health and safety professionals, industrial hygienists, we are the government trained professionals that are always the tip of the spear, leading and managing protocols through pandemics, public health emergencies. We are embedded in hospital systems. We work in both the occupational and the environmental or the community at large environment to keep people safe and healthy, whether it to be on the job or, like I said, the community at large. So when we saw the government's response, particularly Dr. Fauci and Birx, this COVID-19 task force response, we about lost our minds because they literally violated every scientifically proven protocol, all known evidence-based pandemic response protocols. They violated all of them. And we knew because we were government trained. And so we, first of all, lost our minds and thought, what in the world is going on here? And then we started standing up very vocally, very publicly, and making videos to educate people. And just especially when they started masking children, to just warn people, do not go along with this. This is not only dangerous, it is harmful to your children. It is totally illegal because it's violating OSHA's own PPE and respiratory protection standards. And so because we were both trained in the same profession, we were saying the same things, and we actually met on a radio program, the Justin Barclay Show. Justin fills in for Glenn Beck a lot, so a lot of you know who he is. We met on his program, and we connected very quickly, and then we started making videos together that went viral, and we became known as the dynamic duo very quickly because
we're deplatformed multiple times on different apps.
Yeah, like, who gets kicked off of LinkedIn? Right here, who gets their Facebook pages taken down and removed? Who is so censored and shadow banned that they have a hard time getting the information and the education out? Who has been demonized and attacked and accused of being grifters? And which, by the way, this is why we have never charged for any of our testimonies or saying anything that we say, because we know what people accuse us of. And this has only been about protecting the health and safety of our children and employees and following scientifically based, evidence-based protocols that we were trained on. This is not about money for us, believe me. It has cost us hundreds of thousands of dollars to do what we have done, to stand up and speak truth as we're being demonized for it. The only one speaking truth, we're being demonized for it. As we were being censored, shadow banned, restricted. We even had articles written, hit pieces written about us by the Daily Beast and others. I mean, we have been through the ringer with all of this, but we have now been totally vindicated by this U.S. House COVID committee report that's come out. And so we wanted to share this with all of you so that those of you that stood with us, who refused to wear a mask, who refused to be subject to mandates, and knew that the origins of this and that the handling of this was so wrong and inappropriate, a total conflict of interest by Dr. Fauci, total conflict of interest. We're going to get into all that in a minute. But we wanted to go over this with you just to not just, prove our own, credibility here, but also to encourage you guys that those of you that stood strong, you were right and you have now been vindicated. So let's get into this report. We have the bullet
Before
point.
we do, I want to just correct one thing because a lot of the people that were attacking us, which I have thick skin, so it doesn't bother me.
Yeah.
I've been in the Liberty Movement for like 16 years, but the biggest misconception is that we just deal with things in the workplace. And I'm like, OSHA is a public health agency. Think about it for a moment as you're listening to what we tell you. Where do people spend most of their time? Either in their place of work or someone else's place of work. So during a pandemic, who do you think governs and is the liaison for the government and the public and community public health as far as what should we do? What exposure controls and mitigation efforts should we put into place? And that's where we stood up together and everything went wrong. So yes, Tammy, we are both going to be looking down at our phones. We're doing this on the fly. We have a summary of this 520-page report. And if you watch any of our lives, we've already covered this ad nauseum, but this is, and I told you so. So remember the people that were right from the beginning. So they talked about the origins of COVID, which, we're not going to get into that, so to speak, because that's not our wheelhouse, but we all know there was a lot of disinformation and that came to be true. But let's start out with the first thing, how this happened. For me, Tammy, right before you and I united together, I knew the second that they pushed masks, I was like, this is not being handled correctly. And then I remember when you and I got together in the summer of 2020, you were the one saying they're going to do vaccine mandates with proof of vaccine mandates. So I don't know whether to call you Nostradamus or Miss Cleo, whichever one you prefer, but we were right, because the last thing you do, and we want you guys to understand this, is push out PPE. And even though masks are not PPE, they're source control, they don't fall anywhere on something that we call the hierarchy of safety and controls. And at the very top is engineering controls after substitute and elimination. That's more geared towards chemicals, but let's talk about the engineering controls that we've been pushing since 2020.
Yeah. And, the reason that I knew this was going to lead to mandated vaccines, I could read between the lines here what was going on when very quickly, within a couple of weeks, and Fauci started coming on and saying the things he was saying, I could tell this was not about our health and safety. This was about something much more nefarious that was going on. And the reason we knew, and I knew this was not about our health and safety, is because we are health and safety professionals. If it was, we'd be the very first ones telling you this is what you need to do. But what our government did was they violated all known protocols for managing pandemics, and they violated all the known science that those protocols are based on, and the tests that show the studies, the metadata analysis that goes back to the 1970s, which is when OSHA created these standards in the first place. So I knew very quickly something very nefarious is going on here. And when I started really digging into it, and then they started talking about Operation Warp Speed, which is addressed in this, and we're going to address that in a minute, I knew, oh my gosh, this is about vaccines. This is about digital ID passports. And you know what? They've been talking about doing this for a long time. So I knew this was the catalyst. This was the catalyst that was going to get us all to that great reset. And they've been talking about it, the great reset, the new world order, for decades. This shouldn't have surprised any of us. So it was not hard for me to connect the dots very quickly and realize this is not about a mask, people. If you go along with this right now and you fall into line, the next thing they're going to roll out, and I said from stage, mark my words, it's going to be forced vaccines. And then it's going to be digital ID passports. And then your banking information will be tied to it. You'll be forced into a digital currency that is all connected and it's all tied. And this is just the first step. Well, with this release of this House report, all of those details are right there. And it validates every single thing we were saying and warning you about from day one. So I want to, before we get into the hierarchy of controls, I want to address Operation Warp Speed, because that's the first bullet point here underneath the origins of COVID that I'm looking at. And we know that this leaked from a lab. There's all kinds of receipts on that. But Operation Warp Speed, they talked about the failures and successes. Okay, this is the one issue, the one big issue I have with President Trump. But I just want to say, While it is never, ever, ever a good idea to bypass safety trials and protocols and just skip right to injecting people with something that's not been tested, who in their right mind would do that, right? This is an obvious problem, in my opinion. But this was new technology. It has never been used on us before, which was even more critical in the safety and the testing phase. So that is a real problem, to skip and bypass all of that in the name of saving lives. We killed millions of people and injured millions of people. Okay, the reason the reason that I want to bring this up is because there are a lot of people who have, walked away from their support for President Trump over Operation Warp Speed, and I get that. But at the same time, what you need to understand about him is that he is a businessman. He's a New York businessman, for crying out loud, not just a businessman, a New York businessman. Very no nonsense, very able to delegate, put the right people in place, get out of their way and let them do their jobs. In addition, he is not a politician. He did not know how things really work in DC. He did not understand that the people that were advising him, Dr. Fauci in particular, bears almost 100% of the responsibility, with other people like Dr. Ralph Barrick and Dr. Birx and Peter Daszak. I mean, we could go down the list here of who's all involved in this. But it was Fauci who was the face of this, who was knowingly and intentionally lying and telling President Trump things that were not true. And he had such a direct conflict of interest in that because he was making money off the very protocols he was pushing. He owns the patents on some of the medications like remdesivir that he was pushing. So President Trump I don't think, had any clue that he was being directed very improperly and in a criminal manner, that Fauci was bold-faced lying to him. I really don't think he did.
I don't think he also did any of the mandates. That wasn't until the Biden administration came in.
Right.
And that's the most
Right.
important, is that
That's right.
and I have to get, because trust me, very libertarian, voted for Trump. But that was also my big issue, not only as a scientist, but as someone who supports health freedom.
Mm-hmm.
But when he admitted in a recent interview, I think it was on Rogan, that he was ill-advised and he didn't know what he was
Yes.
doing. And if you follow Trump, that's a big admission. So we
Right.
have to move on from that. And I wish he still wouldn't proclaim what a great thing it was. But yes, the
Right.
vaccines were a major issue. And one thing I want to cover before we move on to the next topic is that when it comes to our area, our profession, when the workplace tries to mandate a vaccine,
Mm-hmm.
it cannot be viewed as a control method, because when you do it on your own time, Google the hierarchy of safety and controls. It's an upside down pyramid. When you are imposing any sort of control method, you have to be able to verify the confidence in that control. And I'll give you an example. If somebody is sanding and I've done air sampling to determine that it's an unsafe level, and I have an engineering control and that still doesn't keep it safe, then I put them in respiratory protection. But how did I figure out I also need a second control? That's because I went back to verify the confidence in the original control evaluation. They can't do that. When, Tammy, if you were to inject yourself with anything, I mean, from bioidentical hormones to any medication, your individual human and genetic factor is going to metabolize it differently. It's going to handle it differently. You may have a detoxification issue in your genes. I don't know. But my point is, everybody's different. So we cannot verify the confidence in a control method that is injected into someone's body that is still supposed to be a vaccination. Secondly,
Yes.
there are OSHA letters of interpretation that have showed if any business is going to attempt to mandate a vaccine, they have to allow for all three exemptions, because they have to be educated on the risks
Mm-hmm.
and the benefit. In this situation, you couldn't convey the risks, so it voided the mandate, because there was no insert on these vaccines for anyone to take to their primary care, their functional or holistic provider, to make that determination. So that is why we stood up and said it is illegal to do a vaccine mandate. And I will stand by that. I can show the own OSHA documents and letters of interpretation, and it's something that we do not do. But
Right.
another aspect is it went into the impact on public health policies. So I don't want to stick too long on the vaccines, because we don't want this to be one of our 2-hour lives. But basically what they covered was natural immunity versus
Mm-hmm.
continuous boosters. And while I'm not a doctor, I am an exposure scientist, and I do understand that natural immunity is something that we've always looked at and talked about, and it was completely shut down. But What I really, really want to focus on primarily, because this is where our professions intertwine with this report. And I don't know about you, Tammy, but I kind of felt like I can't believe they had to do a report. And how are we not named in this report?
Right? Yeah,
we
well, like we go way back to, I think we're the OG whistleblowers who were the first people that you heard standing up and speaking up on
Yeah.
this, because we are the tip of the spear whenever there's a public health
Yes.
outbreak or a pandemic, public health emergency, disease outbreak. We're the very first ones advising hospital protocols, things like that. So
I believe it was
it's
the
crazy.
frontline doctors. The frontline
Mhm.
doctors were the first to speak up on its vector and the protocols. But when it
Yep.
came to the exposure control aspect, and that's why I have to give them credit, because they recognize that we're the experts on exposure controls
Right.
and they're the experts on diagnosis, treatment, and all that stuff with the
Yeah, and
protocol.
that's why we joined forces with them and have
Yep.
been traveling and speaking and educating the world. I mean, we've traveled all over the world now on this. So, yeah, I mean, it's really important that people understand what we have been saying since the beginning is 100% accurate. And we know, again, and we keep stressing this because we get so many people attack us. Well, all the experts say, no, those were not the experts. They were people that were guilty of malpractice, speaking outside of their lane on something to which they are not credentialed, trained, and experienced to speak on. That, let me be very clear on that. That's why we took so much criticism and so much heat, and people demonized us because they just thought, well, who are you two? You know what I mean? So it's important that we come back and review this now.
Absolutely. And what I think we should focus on are the improper exposure control methods. So, if you want to just kind of, we're so good at just passing the baton, and
Yep.
sometimes we kindly interrupt each other. But so I think we should cover the masking, the plexiglass, the dummy dots, and what it felt like for us in our profession to know that OSHA allowed themselves to be captured. And to me, the head of OSHA needs to face criminal charges. And then maybe
Absolutely.
into the letter that we got from the OSHA Training Institute, which is hilarious.
Yeah,
But
absolutely.
when I first saw masks being pushed, and it was already deemed by aerosol scientists that this was an aerosol transmission, which just means that it's small, tiny aerosols that get embedded into the deep lung.
Mhm.
Now, in our profession, we use things like Stokes' law. We do different calculations. I think people just think we sit at a desk.
Yeah.
We are now. No, we go, we go everywhere. Where there's a hazard, we are there. So
Right.
we have to calculate dissipation rates of aerosols based on different ambient conditions, air exchanges per hour, intertwining it with relative humidity. I don't want to
Mhm.
bore you with the science, but we know what we're talking about. And I knew that masks are not to be used for an aerosolized virus or any other aerosolized hazard. Why? Because the masks had gaps here, had gaps here. And when you have greater than 2.5% leakage in a mask, it renders it useless for an aerosol. Not to mention, they're not rated for aerosols like this. Then you have to think about all the things that we saw. I feel like I could make this into a whole documentary just talking about masks, but
Mhm.
you saw the government promoting masks to people that in our profession, and I remember putting out a graphic on this on Twitter, and they told me I had to delete it in order to get my account back before it was X. It was showing a
That was
comparison.
before Elon. Thank God for
Exactly.
Elon. Yeah.
I showed like what providers do when they look at a prescription. They ask you your human and genetic factors. What else are
Mhm.
you taking? Are there contraindications? And they tell you don't drink alcohol when you're taking this muscle relaxant. If you take cannabis, don't take a nerve medication. It can slow your breathing. So they
Right.
look at all these things. But when it came to masks, they just put them out in the grocery store with the box open so that the horrible air exchanges could just descend down and all these infectious aerosols went right in the box. And I know that people don't like hearing this comparison, but it reminded me as we're using band-aids or panty liners. That's literally how gross the cross contamination was. So
Mhm.
when we were sitting here, you had people with beards, you had children on the spectrum, people with PTSD, um, COPD. And in fact, I just went to my daughter was in the hospital. A lot of people saw that story. She had sepsis. She's fine now. Everywhere all over U of M Metro Health Hospital were these masks with the boxes open by the elevator, by the front door. Those are supposed to be stored in cool, dry areas away from dirty
Yeah.
areas.
To be kept
And
sanitary.
said,
Yes.
if you have any respiratory symptoms, if you are someone with asthma, you better not put on a mask. If you're someone that has COPD or cystic fibrosis, you
Mhm.
don't impede the proper gaseous exchanges.
Right.
Again, I'm summarizing the data because this could be long-winded, but we saw the government pushing a very dangerous control method that
Yep.
not only did not work, it wasn't one size fits all, it wasn't meant for children, and it was handed out with zero instructions. So I'd see people
Right.
wearing them in the rain, wadding them up, reusing them. What they did to healthcare professionals even worse, making them rewear them. And they were talking, well, there's a shortage of N95s. You shouldn't have even been in N95s. You
Right.
should have had a contingency plan like I had working for the federal government for 12 years. We had PAPRs. We had
Right.
PAPRs. We had all the materials to shelter in place for up to 72 hours. PAPRs, just so you guys know, are hoods that look like space hoods with air packs, fresh air packs, and they're you don't have to be clean shaven. And when
Yeah.
you are dealing with, I'll just want one more example. I ran a
And
decon line when I worked at a VA hospital in Chicago, and I was training people on why we do not use masks or N95s for unknown hazards or aerosolized hazards and viruses.
Right.
So this like glow in the dark powder that is only shown under a black light, and it showed where everyone touched their face. And I was like, do you understand now why we wear PAPRs for first receivers? So my point is, combined, we have over 45 years of experience in what we're talking about here. And the mask mandates were so reckless. And where the hell was OSHA? And I really hope that these people are called to the carpet. And when I advertise this live, sorry if you hear noise in the background. My producer, my orange cat, is banging on my French doors to my office. But we also, at the end of this, are going to provide solutions. Because, Tammy, can you now just switch into the ridiculousness of the dummy dots and the plexiglass while I go unlock my door so that we don't hear banging?
Okay. Yeah. And I just want to touch on real quickly, when Kristen says we wear PAPRs or cappers, that's the only type of respiratory protection that would have worked to stop the spread of an aerosolized infectious virus, right? And so if you watch shows like The Good Doctors or Grey's Anatomy, you see them in a contagion environment, and that's what they're wearing. It looks like a space hood, like Kristen said. But they're wearing that correctly on those shows because it's the only type of PPE that is rated. So to stop against a particular virus or spread. Hang on just a minute, Kristen. I just realized my computer's not plugged in and it dimmed on me. So you don't want to
I
lose
know how
me.
that goes. This is when you do on the whim live. So
Right.
basically, while she's doing that, I want to tell you guys, we intended for this to be very short, but I do.
That's always hard because it's so technical.
For 20 minutes, but it is so important to convey this information. So go ahead, Tammy.
No, it's just so technical, and people really need to understand, because it was very difficult for us to educate the whole world. Just a couple of us standing up against this demonic global narrative and agenda. But you know what? We did it. So here we are to recap. And I want to talk about the stupidity of the dummy dots and the plexiglass and arrows on the floor. Thank God y'all followed the arrows on the floor. Now you're still alive today. Thank goodness for those stupid
It felt
arrows.
like a game. Slide to the left.
Honestly, I actually would purposely walk the other way.
Me too, girl. I was a total anarchist in the grocery store.
And then I would lean around the plexiglass to hand my money, because it's like that kind of stuff is based on, and Dr. Burks admitted in her book, for crying out loud, that none of this was based on science. It was just made up, and what she said to get people to, quote, do something. Are you kidding me? You disrupted our entire society, caused great harm financially, educationally, the physical and mental health issues that were created because you wanted people to just do something. Well, how about you follow the real experts and we handle things properly, like we did with H1N1. Where was Barack Obama during H1N1? Golfing. Yep, people were dying. Nobody cared. Nobody talked about it because people like us in our professions were properly handling it to the best of our ability, and we had very good outcomes. So you don't just put up a piece of glass, plexiglass, and think that a virus is going to stop. It's not going to go under it. It's not going to go around it. These aerosols will stay suspended in the air for weeks.
Sometimes up to 30 days.
Yeah. A piece of plexiglass where you can, reach around, reach under, it's not going to stop. It's like, okay, do not pass go. Stop right here. It doesn't work that way. It was no different than following arrows on the floor. I thought, what is this going to do? Or stand 6 feet apart. If somebody sneezes with a mask on, by the way, it is going to cause that projection, that plume, to go even further. So you are in closer proximity with the aerosol, the virus. If somebody, is infected with it, they're walking around, they cough or they sneeze, and they got their mask on. Now it becomes a projection towards you at a much higher velocity. And see, we study all this stuff. I know it seems boring, the movement of air, velocity, all of that, but this is why we're the ones who lead with proper protocols, and you don't do dumb stuff like that because it actually creates a greater hazard. And creating a greater hazard is the number one no-no in our profession. We are never allowed to implement any control measures, whether they're PPE or engineering controls, administrative controls. We're never allowed to implement any control measures that create a greater hazard.
Correct.
Right?
Thank you for pointing that out.
That's why we had to address all of that stupidity, because not only did it not work, it actually created a greater hazard to the public. And it was our children that really got me standing up, and I just became like, I don't care what happens to me, come what may. I don't care what money I lose, what clients I lose. I have got to speak truth because our children's very health and well-being is at stake here.
Absolutely. And I just want to give, I was checking comments in case people had questions, but shout out to my friend Gary Franchi at the Next News Network for sharing this video, because it's very rare that we get people to share our lives that are media corporations. I've known him since the Ron Paul days. But it's important that it's not about the follows for us. It's about our reach. We've been so shadow banned, but yes, dummy dots, but everything we're telling you, like, imagine what it's like to be in this profession and go, why in the hell is OSHA not saying anything? Like, I really want to know. Maybe one day I can FOIA this stuff as they start deleting emails because I said that, because I want to know what was happening, because I can tell you right now, I'm not going to name names, but Tammy and I have ran into people. I ran into people traveling. Even going to a Bears game, I ran into a guy that worked for MyOSHA that retired early because he called it out internally, and they were told, yeah, we know masks don't work, but we have to do something. And this guy was like a 30-year IH. I worked for the federal government for 12 years. I know, and I still know people in OSHA, and they're like, yeah, we have to listen to what DC says. Well, grow a pair and do the right thing, because federal employees do take an oath when they are hired. And I just understand. But what happened was Tammy and I were speaking out. We were doing testimony all around different states. We went to North Dakota twice. And one day, on the same day, I believe, we both got FedEx packages we had to sign for. And it was a demand letter, not from an attorney, but from the head. I wish I knew his name so I could call him out. The head of the OSHA Training Institute, who wanted us to stop calling ourselves OSHA credentialed experts. First of all, he was phrasing it in a manner in which we claim to work for OSHA. And I just want to be very real. I'm being serious when I tell you, working for OSHA for me, unless I was at a GS 15 or higher, would be a demotion for me, because I work for the federal government. I don't want to make more as a consultant than I ever would in OSHA. And also, I work for the government, and I know what it's like to try to do the right thing and then be demonized. I've been through that. But this letter, it was so funny. And I think we have a live still on YouTube somewhere. I wish I could embed the clip, but we didn't claim we worked for OSHA. Every speech we've given, we've said we are OSHA credentialed experts, meaning like we were trained by OSHA, OSHA 30-hour, we were trained the trainers. And then I whipped out a binder that said credentialed in, like all my bloodborne pathogen, respiratory. What are you talking about? No, it said certified in bloodborne pathogen training.
And multiple disciplines.
Different.
We are sorry to interrupt you, but we are not, you need to understand this. We have been trained by OSHA and credentialed in these areas, multiple disciplines.
With certificates saying certified in.
And the EPA and the DOT. We are also very highly EPA credentialed. We are highly DOT trained and instructors and credentialed. So when Kristen says we get a letter from this, some guy who runs one of the OSHA training institutes, what authority do you have? Who do you think you are? I mean, we laughed, and we actually went on air and called him out by name, and we read the letter, and it was just ridiculous.
I think we did it over a glass of wine because it was that ridiculous. But, we try to inject humor in what we do because it's very mentally taxing, and we do it for you guys. But this, if we go back to this report, I mean, the point is, I mean, when I look at this report, I do appreciate it. I do appreciate it. But honestly, how did you do this report and not even contact us? I don't know if they contacted anyone, but I also have
Right.
to give a shout out to our colleagues that engaged in we had a America Frontline Industrial Hygienist and Multidisciplinary Support Summit that is on the Choose Freedom channel on Rumble. And Tyson Gabriel, Stephen Petty, Megan Mansell. We had Dr. Christina Parks.
Dr. Avery Jackson.
Dr. Avery Jackson, a neurosurgeon. We had Nurse Jody O'Malley. So what we did during our day-long, no one had a speaking fee. Everyone paid their own travel. What we did was we did a full day to a bunch of state legislators in Michigan, and we shared the video to show what a multidisciplinary approach and review look like. So while we are the exposure control experts, we also need to bring in other people who are handling other aspects of a pandemic. Because what we do, again, as IHs, is we take the data on and we help determine routes of entry. So we're not treating people, but we do know how to decon if they're going through a decon line or a first receiver line at a hospital. So this was so mishandled that to this day, if I do not see under the Trump administration some accountability for OSHA and the EPA for East Palestine, that's for another video. We called out that too. And we were expert witnesses in a court case exposing the wrongdoings. So my point is, let's transition now into what we can do, because I personally think, I mean, in my perfect world, OSHA would be disbanded and be privatized.
Absolutely. Absolutely. And that's the biggest problem. And, Kristen and I did call out the heads of OSHA. I went to the director of the construction division when they started citing my clients for not just putting a piece of cloth over their face. And I was like, what are you doing? What are you even doing? And he just gives me a bunch of MCL Michigan code law. And I said, you should lose all of your credentials because you're a certified industrial hygienist. And you know damn well that what you're doing is actually illegal and very harmful. So we have called these people out. By the way, he doesn't work for OSHA anymore. He went into the private industry.
But Tammy, do you remember? I think I reached out to you as my phone a friend when this happened. I had an electrician reach out to me, and he was talking about how he was working, redoing like a hotel or something. He was the only person working on his entire floor. Just so you know, if you're not familiar with certain electrical work, what you're wearing has to be fire retardant or FR rated, for those that are triggered by the word. They cannot have things that are not intrinsically safe.
Right.
Masks that they were telling people to wear, because remember, Tammy, it was a handkerchief and grandma's curtains and then any mask, and people thought they were doing the right thing and selling them on Etsy and all those things. That could have created a greater hazard for the electrician, and I got him exempt. But it sucked that people had to reach out, and I never charged for any of this. I know you didn't either, because a lot of these people sadly didn't really know what our profession was, because I always joke, people don't know who we are until things go wrong. And as we all know, things went wrong. But what I want to see, what I would like to see are individuals like us, Stephen Petty and Tyson Gabriel, who I know would all be willing to do this. It would be great if there was positions as ad hoc professionals where we could come in as civilians and really make sure, like we do, like quarterly reviews, like QA/QC, because once you open Pandora's box and completely violate your own standards, like there's no coming back from that. And there needs to be a line of accountability.
Right. And that's what we were calling out very publicly, very vocally, that got us shut down, because we were saying, look, OSHA is guilty of revisionism. They are violating their own standards, and they are citing people who don't also violate the standards. Right. I mean, it doesn't get worse than that. So I honestly, I believe, and I really strongly feel that this new administration has to go and fire all the heads of these agencies, because they're all in on it. They all went along with this, and it was a very coordinated effort. And yes, they were all in on it, and they were pushed from up above, and they pushed down below, and they coordinated their efforts very quickly to get everyone in lockstep doing the same thing, saying the same things. It was so nefarious and so coordinated. Every single one of these people in the EPA, in OSHA, the DOT, we saw all kinds of craziness. Signs, for some reason, during COVID, we didn't need proper signs on roads. It was very dangerous. It was just so crazy. All of these people need to be fired, and they need to be prosecuted to the fullest extent of the law, because I don't mince any words when I say these were the greatest crimes ever committed against humanity. And these people need to be held accountable. And
Yes,
we have got
because
to restore faith in our public health agencies. And some of these, some of these regulatory agencies need to be dissolved. We have over 100 regulatory agencies in this country, and they are strangling us. And now they're being weaponized against us, and they've been captured. So much of this just needs to go away. I'm sorry, but
I almost
it's
just
too
dropped
much.
an F-bomb, but it would have been just. But anyway, I'm right there with you, because people will look at us and go, oh, but OSHA says.
Yeah.
And
Right.
and who's profiting off this? Because it's not me. And then I have
Right.
to walk this very lightly. And there's things that you don't know, Tammy, and I just don't respond at all. I have to tread lightly. I'm telling you, I took quite a bit of legal action due to discrimination involved, because I medically can't mask. I sued some people that should have known better. And unfortunately, those outcomes are not known to the public, and I just chew my tongue. And the situation is that I, as a veteran, as a disabled veteran who was an IH over a VA in Chicago, I had to get these tearful phone calls and voicemails and direct messages of people telling me I can't even go to my VA appointment without being harassed because I can't wear a mask. I didn't realize it would ever bother me, but it reminds me of being blown up on my gas mask. It reminds me of hiding under this. And people are facially claustrophobic for many reasons, sexual assault survivors, many things. And it broke my heart. And it's not just veterans, there are other people, but the VA turned its back on the very people it's supposed to protect. And they knew better. And I also, every time I went to a VA, I even, I'm not going to even name locations, but I contacted the industrial hygienist at 3 different giant VA hospitals. And if people don't understand, there's VISNs, and I reached out to VISN heads. So VISNs are like networks, and there's different VA states and hospitals under that. And I called them all, and I said, I won't ever say your name. And I have not even told Tammy, because I'm a person of great integrity. They all told me they knew, and they were upset. But the VA in Washington, D.C., and I clearly said to them, you still need to stand up. And if anyone comes after you, trust me, I've done enough pro bono work with attorneys. They will represent you, especially like we did Patriots USA, because you've been a whistleblower. And these people were so scared. And while I want to call them out for not standing up, like, that is sad that people at that level, these are like GS 15, 17s that are high up, that were so afraid to say anything because of like DC. And like, DC is known as a swamp for a reason. So it's so frustrating that, well, DC says, well,
the CDC says, OSHA says.
People need to understand what the CDC really is, and they can only provide recommendations, just like the Federal Reserve is not a federal agency. And I just want to kind of wedge this in, because my husband does what I do. My husband was actually appointed to be the Ottawa County new administrative health officer. And he actually had higher credentials than the woman he was replacing. And she, we found out, was actually supported by this group, Nacho and pharmaceutical organizations. They supported her through lawfare to where there was no opportunity to not have a lawsuit for 5 years. So they just decided to stick with her. And my husband completely understood it. But here's the thing. They said that my husband had 0 public health credentials, no experience in public health, because he worked in the private sector. Newsflash, most of us work in the private sector. And he said masks didn't work, 6 feet distancing didn't work, the dummy dots didn't work. And then he used the data from actual people like Dr. McCullough, Dr. Malone, all the people that were treating patients. And he said, I would confer with these people. And we would, like other countries, be mailing out the vitamin D because it was the winter and there's not that sun exposure. He can't prescribe, he's not a doctor, but he literally said everything that's been proven right. And of course, will there be any retractions on the hit pieces? No. And are his feelings hurt? No. But my point is, think about all the good people that we try to get at the low level public health counties for the next pandemic. And I say that not that it wasn't real, but how it was handled was a scam. These people will never take positions because they know it's easily captured. You get unhinged people in there from either side of the party that are loyal to the bureaucrats and pharmaceutical companies and these large organizations like Nacho. It's a public health organization. you're not getting good people. So then when people say, well, this person in this government position, yeah, because the good people don't work for the government for a reason.
That's right. And it's one of those things that the administration has got to address quickly. And I know they are. I know they're on it. But with people like us in steering committees and advisory and consulting roles, working with those who take full-time positions, we can really right this ship quickly. We just need to gut these agencies, and we need to get back to following scientifically based protocols with integrity, not for profit. And this is where the fascist relationship between big tech, big pharma, big food, big agri, the media, the banking systems, we have become a very fascist nation, and all of our regulatory agencies and our media and our healthcare systems, our food, have all been captured, and they're all being run by a few at the top for big money. And I love that Trump and RFK Jr. recognize this. And so we've got to get good people in place to help them in every area, because it's going to be a total overhaul to undo fascism. I don't know that there has ever been a nation that has successfully destroyed the fascism without civil war. So this is a huge undertaking. I mean, we have to realize what we are up against. The good thing is, what we're reading to you right now off of our phones, this report, Congress is aware. Our government, elected officials, our incoming administration, they are aware. So now that the exposure has happened, now we can get to work, hopefully, prayerfully, with the accountability piece and fixing it, addressing it, holding these people accountable to the fullest extent of the law, setting a clear precedence that kind of deception and the lack of integrity, the unethical behavior, the conflicts of interest, it will not be tolerated. We need to set that clear precedent, and we need to make examples of these people. And then we need to get good people in place with checks and balances, good systems of checks and balances with people like us who are private industry, private sector, sitting on these steering committees and advisory committees that have very influential roles. That's the only way you avoid the silos that develop with government agents and actors within each agency being allowed to call all the shots with no accountability. That's what's happened here. And then they team up with other organizations and agencies like big tech and big pharma, and that's how this has been allowed to happen. So, there are solutions, and we can get involved and help there, but we can never allow this to happen again. We can never handle a pandemic like this again. The suicide rates have just skyrocketed and gone through the roof. It looks like my camera just
Yeah, just go to your settings.
Can you hear me?
Yeah, I can hear you. You're just
Okay,
now like the
good.
Wizard of Oz, but it's fine. Or just go to your settings and see if your camera turns on. But I also want to add, I want to thank people who have given us a voice. There's so many people to thank, but as far as like at the federal level, Congressman Thomas Massey, Senator Ron Johnson, and Senator Mastriano are people who've been aware of what we said, and they've had their hand in this, whether it's East Palestine or this scamdemic situation. And, like, especially We the Patriots, USA CHD, we've spoken at their events, InfoWars with Alex Jones, like people, a whole bunch of podcasters and alternative media, which are the real media.
Del Bigtree, we got to call Del Bigtree.
With the High Wire. There's been a lot of people. And if you guys want the receipts that we have been speaking up, I think the best platform to look would be go to Rumble. And I will upload this to Rumble on the Kristen Megan TV channel. For those who want to watch it.
We'll put it on Choose Freedom too. If you go to the Choose Freedom channel, and then you can scroll down there and you can see the summit that we put on. It was 5.5 hours, so we broke it down. But you're going to hear from all the experts in our career field who are the only ones who should have been speaking and leading and managing through this. It was that multidisciplinary team who was actually blowing the whistle and exposing this. We had all of those recordings on that channel as well. And then on Kristen's channel, a lot of our interviews and things are there as well.
Yeah, just search our names. Like, we don't just do the COVID stuff. We've had our hand in many things. Yeah. And if you just search Kristen Megan and Tammy Clark on Rumble, related to COVID, put COVID. If you want to learn about what we've done with East Palestine, Ohio, you can put it there. But I just have to say, I saw a comment on YouTube. It says, if none of us are on a government watch list by now, we should all be ashamed of ourselves. Well, I got Tammy a shirt and I have a shirt.
Yeah, you should show me a shirt.
Yeah, I'm in a boot right now. I got some massive tendonitis going on, or I'd hobble up and get it. But I have a green one. Tammy, do you have a green one?
I have a red one.
A red one, and it just says naughty, nice. It's like a checkbox. Then it says on a government watch list, and that one is checked. And because we are the dynamic duo standing up, I got her shirt, and then also our friend Rachel Atwood, who you should also follow on X at Real News Rachel, because she stood up with us a lot through this. But I think we should recap this because I think we're at like 35 minutes. 40 minutes. Who knows? Who's keeping track?
That's 45 on my end, live 45.
Oh, okay. Yeah, I went to public school, but
well, I can see it. But yeah, these long videos are hard for people to watch, but it's really hard for us to recap everything in, a report, a 500 and some page report in, 15 minutes. So anyway, we just wanted to encourage you guys that as we recap this, you were right. Great job. Hats off to all of you that were demonized, were censored, and you stood strong anyway, and you didn't cave. I mean, wow, you got some cojones and steel spine. Yeah, so I love it. I love it. I love it. So, and we love all of you for supporting us, for encouraging us to stand and, to keep, to take the information that we did, the white papers and the letters to the White House and the CDC, and you used all of that. You used it with your schools and with your workplaces, with your HR departments. And so we provided the information and you guys used it, you shared it, you supported us. And that really kept us going. The encouragement kept us going because it has been the hardest fight of my life over the past 4.5 years that has cost both Kristen and I nearly everything.
And we also had our hand in election integrity and a whole bunch of other things, but we wanted to address this. So thanks for joining us. We meant this to be 30 minutes, but let's be real. It's impossible. But if you guys want more information, like I said, look up our names. You can see it on the screen, on Rumble, even some on YouTube, or even on this app. And my handle on X is at Kristen Megan. And Tammy, what's your handle on X?
It's Tammy_K_Clark.
And if you want to follow me on Facebook, everything's public. It's Kristen Megan Kelly. But my biggest platform and outreach is on TikTok, which is Kristen Megan TV. Either way, again, we're here not for the follows. We're here for the outreach. We want to educate you past the propaganda. So thank you for joining us. And my coffee is now cold. I need to get a new cup. Tammy recently moved to Florida, but she kind of still comes back to Michigan. I'm having withdrawal symptoms, so I need you to come back.
I know it's been a long time. It's been like a couple weeks. I'm having withdrawals.
I know. I'm gonna get a blanket with your face on it because I get separation anxiety.
Well, I think I've spent more time with you than my family over the past several years. So you have become my sister wife. That's for sure.
Absolutely.
But look, we can still do this. I'm down in Florida. You're in Michigan, and we can still do this together and do our thing and keep fighting for this country and for our children together. So, it's all good. I'll be back in a week.
All right. This is our new long distance relationship, and I have issues. But anyway, in all seriousness, thank you guys for tuning in. This will be on the Rumble channel, Kristen Megan TV, and Choose Freedom, in probably the next 24 hours. And please share this video. It's important for people to understand that for us, this wasn't news. But go back and search our feeds where we were telling you. I had many videos. People took my videos, I don't care, and got millions of views on things that I said, showing the government studies. But again, OSHA completely, I don't know, I can't, they shit the bed, for lack of a better term.
There's no words. And it was intentional. It was intentional.
It was very intentional. And I think that we have to worry about being we are professionals, but sometimes we just have to lay it out how it is because we care about we the people. And we have an oath to our profession, which is to create no greater harm. And that's all we tried to do. So thank you guys for joining us. Everyone, enjoy your Friday. Be safe. And another side note.
Your share.
Yes. If you are, one last thing, if you go to a hospital or grocery store, very kindly explain, hey, if you're going to hand those out, because don't go with the narrative of they don't work, they don't care. you're going to hand those out, could you have a lid on the masks because you're causing cross contamination and creating a greater hazard? I follow 2 exposure scientists who educated me on this because that gets
Right.
it going, because it really does. It is creating a greater spread of the flu and other things when you have masks in a dang grocery store or hospital where everything is falling down.
Right.
So
That's right.
anyway,
Love you all. Have a great
day.
weekend.
And hopefully my mouse works. We don't have to do another live if the government can just get itself together. Take care.